Welcome to Interdisciplinary Case Miles, a podcast where real runner stories meet clinical expertise. We discuss real cases that are anything from weekend warriors all the way to elite athletes, while using our evidence-informed approach.
I'm Dr. Sara Raiser, a running medicine physician focusing on helping runners prevent and recover from running-related injuries while optimizing health and performance.
I'm Kelsey Pontius, a sports dietitian helping runners to fuel smarter, recover better, and help avoid the risk of injury so that they can meet their goals.
And I'm Dr. Mihevc Edwards. I'm a physical therapist and orthopedic specialist, and I've been treating for runners for over 15 years. And what I do is help them get back stronger and better. Today's case is a 49-year-old female runner that presents with pain in the arch when she first starts walking, when she's running or on her feet at all. The pain sometimes gets better during her run unless she has a difficult workout. So hill repeats or speed workout really aggravates her symptoms. She's already seen 2 different PTs and 2 or 3 MDs prior to coming into the office to see me. She was told that she had plantar fasciitis, but none of the treatments that she's had so far have been helping. She's been working on some foot strength. She's been getting some shockwave. She's had some soft tissue, and she's been also working on hip strength. But so far, things haven't really gotten better. So since she saw me first, I'm going to kind of talk through a few things, and then Sarah, I'll have you jump in right after. Okay, so when she came to my office, she was diagnosed with plantar fasciitis, but every case that I see, I still do a full evaluation. And even if they come in with something on the script, I'm still going to try and figure out, is this actually what it is, or is there something else? So I go through my differential diagnosis. And I kind of felt like with this case, I had to go back to the drawing board because she had already seen a bunch of people. So her pain was actually not just in the heel. A typical plantar fasciitis case will have pain in the heel. It'll be when you first wake up in the morning and put pressure on the foot. Sometimes it'll be in the arch, but usually that's really it. This patient, she actually had pain in the heel. She had pain in the arch. She actually had pain that was going up on the inside of her shin behind the medial malleoli, which is that kind of bump on the inside of your foot. And so that's where I started to think, okay, maybe this is not a classic plantar fasciitis. This might actually be something else because it's not really presenting completely like a plantar fasciitis. The other thing that kind of stood out is that she had pain when she got up from sitting, but it was not always in the morning. So it was after she'd been kind of not moving around a lot, but then the most pain that she actually had was after hard workouts. And again, that really was something that stuck with me during her interview, is that hard workouts. So things where she's really pushing off the foot, things where her foot might be collapsing in if we're thinking about mechanics. And that's what she was really having a hard time with. She continued to run during this process, but then she slowly started to back out of running because she didn't know what to do anymore. The other things that I saw during her initial evaluation were that when I was testing her foot itself, I was pulling back her big toe, trying to stretch on the plantar fascia. That didn't really reproduce pain, but what did reproduce pain was single leg heel raises and even a little bit of jumping on that foot. So again, those are some things that stuck out to me that it might not actually be plantar fasciitis. Why don't you jump in here, Sarah?
Yeah, so I think the differential is really wide for this particular one. And it almost sounds like, too, that there's pain in multiple spots. And surprisingly, more than one thing can be going on. Although as medical providers, we're always kind of taught that there's kind of one thing that answers everything. So that's where we start, but then consider that things may kind of expand out. So sometimes I talk about it kind of like peeling back the onion layers. Are there other things that are kind of impacted? And if we can cool those off, will it send us to the focal point of where the pain is? So a couple things that I would want to rule out in this scenario, especially with you saying there's some pain with a hop, is there any bone stress injury? Certainly a posterior tib has some attachments to several of the important tarsal bones. The navicular is a really big one. Navicular bone stress injuries, we don't mess around with. So if I've got any concern for that, usually there's pain on what we call the in spot, so pushing on the very top of the navicular, or they have pain in forced dorsiflexion. So really flexing that foot up can potentially cause pain. And if this is a high volume runner, I just don't hesitate to rule it out. We get the MRI, we make sure there's nothing there before moving on. Other common things, osteoarthritis. I've seen stress fractures, even in like the metatarsals, show up as odd medial arch pain. And I've even seen popliteal artery entrapment show up this way. So nerve pain or vessel pain. So if they're getting ischemic pain from popliteal artery entrapment, that can also show up this way. And it's not usually the first thing you think about, but after you see a lot of runners, it shows up a little more often than you might think. And sometimes, Kate, you mentioned this, the shin pain. Sometimes it just shows up as shin pain and then later evolves into some of the foot stuff too. So that medial tibial stress syndrome where folks are having pain in their distal third of their shin can definitely be involved in this as well. So I will oftentimes do a fair amount of workup here just to rule out the scary things like the navicular bone stress injury. Talar bone stress injury is a possibility here and a scary one you don't want to miss either, but usually it shows up as more kind of vague discomfort unless maybe she's been running on this for a very long time and then it kind of escalated to involve everything. So that's usually my job is to get that imaging, make sure that's okay. Maybe even throw an ultrasound on. So take a look at the plantar fascia. The posterior tib are super easy to see. Is there a bunch of thickening? Is there a bunch of fluid around it? Partial tearing? So really easy things to take a look at in clinic and kind of get an idea of what's going on. But it sounds like she started down the right path, at least from the physical therapy standpoint. So what else did you end up doing for her, Kate?
Yeah, so what we ended up doing is we looked at her biomechanics, obviously not just her strength, but when we got her on the treadmill,
above the knee?
We actually talked about this before the episode. Do you look above the knee when you have foot pain? Absolutely. So we did look at strength and we did look at biomechanics. With her strength, I noted that there was some hip weakness. So the first few PTs were on to something in terms of managing that hip and pelvic girdle stability. Because if you think about it, anytime we're having pain in the foot, particularly if we think it's something like a posterior tib issue, we want to be able to control the pelvic girdle. Because if your knee starts to dive in, which is what happens when there's weakness in the hip, then you also start to go into a little bit of pronation. And when we go into that pronated position in the foot, you're actually loading that posterior tib tendon. And so we really want to make sure that we can control that hip and the pelvis as well as the foot and the ankle. So for something like this, we'll be treating above all the way up to the hip, probably even the thoracic spine, because you know how I am. And then the foot control and the big toe and being able to control that. But then when it came to biomechanics, some of the things that I was seeing were basically the same as the single leg squat. Again, we had some knee valgus, we had some femoral internal rotation, and we had some overpronation, but it wasn't just overpronation. It was also what I would call late pronations. So what happens is that when the foot pronates, it pronates, but then it pronates very quickly at the end. And then it has a hard time coming out of that pronation. And if we think about the posterior tib tendon, part of its job is actually to support controlling that motion. So every time it goes into a quick pronation, that tendon is being tugged on and it's being stressed out. And so if it's being stressed out, then we need to think about that in terms of what we're going to do to offload it a little bit. And so we saw that in the gait. And then we were also talking about shoes before the episode, shoes and what would we do with shoes and orthotics. And so for some particular injuries, something like this, if they're really having a lot of pain and they have a race coming up, I might have them use orthotics initially just to unload the tendon itself for a short period of time. I'm not a huge proponent of orthotics in general. I prefer people to work on their foot strength and their hip strength. But sometimes to offload the symptoms, I will put them in a temporary orthotic. So that's something that we did. And then the other thing is this athlete wanted to be in carbon-plated shoes a lot. And carbon-plated shoes actually are not great for this particular diagnosis when they're already in pain and they have swelling on that tendon. I didn't mention it before, but that was another clue that it wasn't necessarily plantar fasciitis, that it was more a posterior tib issue because there was swelling along that tendon. Sara, do you want to talk about the carbon-plated shoes because you were so excited about that in the beginning?
Yeah, so I think the carbon-plated shoes, I think one of the biggest things with them is that you really need to be like at your peak healthy to be using them. They're going to put a lot more stress through the foot. And we have a case series that's published more specifically looking at navicular injuries, so bone stress injury increase. And navicular is one of the bones that posterior tib inserts into. And so there's certainly connection there. So I think the biggest thing is, things need to be very healthy, and we're using the carbon plated shoes very strategically when we are using them. And if you already have some foot pain or tendon issues in the foot, prior history of navicular stress fractures, those may be reasons not to use them or take that risk, or calculated risk, I suppose. So, and we talked a little bit, I agree, orthotics are one of the things I actually like to use in this scenario when people are actively in pain. I'm like, I want your foot to be able to do the work, but while you're having pain, you're inhibiting all those important muscles anyway, and you're causing more problems up the chain. And then I know you love to work on this too, Kate, but the first ray stability and really making sure that arch is doing its job. One of the things I alluded to a little bit earlier was nerve pain. So I always ask people in these scenarios if they have any tingling, numbness, and that's something I'll kind of screen for on numerous occasions, because sometimes things like tarsal tunnel show up with or without posterior tib. Yeah, and there are things we can do to help with that, but that's essentially the nerve getting tugged with all those same mechanisms. So I see tarsal tunnel show up that way with or without posterior tib being involved as well.
Well, and I think something that was mentioned earlier is that with something that's been happening for a long period of time and you've seen a bunch of people already, sometimes it turns into more than one thing. And so it's not always clear cut. So perhaps it was just posterior tib issue in the beginning, but it could have also been some plantar fasciitis in the beginning that turned into some posterior tib tendinopathy. And then, of course, that neural involvement. I always look at neural mobility every time I'm treating somebody. And typically with any kind of chronic injury, there is some neural mobility issue that we do have to work on. So I think that is a great point.
And I know we lightheartedly mentioned it earlier, but I just want to reiterate to listeners that it's so important that your physical therapist look above the knee. Your physician too, for sure. But making sure that you're looking at everything, because we were talking earlier as well about this, that, sometimes the issue is actually primarily the pelvis, and the posterior tib is the thing that suffers. So making sure your glutes are strong. And as I was reminded in clinic today, they may be strong on the table with manual muscle testing, but you get them upright in a functional position and they may not be able to activate those muscles like they need to. So making sure to look at all those positions. And my medical student caught it too, which is great. So making sure you're looking at the whole kit and caboodle. And I've learned about thoracic spine being involved in these scenarios too. I think it's huge. And we forget sometimes that runners are not just legs.
Yeah, and it's not just hip abductors, which we talked about earlier as well. It could also be hip rotators that are part of the issue. So making sure that we're not just testing and looking at hip abduction strength. And, my favorite thing, not just doing clamshells all the time, doing other things. But I had to bring it up because we're talking about hip rotation and abduction strength. I'm sorry. Hey, Kelsey, you want to weigh in on this case?
Sure. Also, if you need some motivation to not wear super shoes while you're trying to work out, just remember we train for adaptation. We don't train for confidence. And that it can also be a reverse psychology of using a different shoe. And then what I like to do is just be like, oh, it's going to be faster on race day when I wear my fast shoes. So a plug for not always wearing the fastest shoes you own when you're working through something. So the nutrition implication of this, I think that there's a lot. Any kind of tendon's going to be more vulnerable when your body's in a state of low energy availability. We know that and it's for a lot of reasons. Either A, the body's not getting enough nutrients to keep the tendons and all of the structures in the body nice and strong. Or B, there's a fatigue element and a recovery element of if you're trying to put together training and maybe this athlete wasn't in a place where she's modifying training yet. So she has the stressor on her body of a full training load, long runs, workouts, that kind of thing. And so if there's a mismatch of fueling that's not meeting up to satisfy all of her energy needs, not just who she is as an athlete, but who she is as a person, what is she doing outside of running, then her needs are going to fall short. And then her musculoskeletal system's going to take the hit. One of my favorite things that we've talked about a lot on this podcast is if your body is getting fatigued during sessions, then the proper mechanics that all of this strength work is trying to teach you to do, that those are going to fall short a lot quicker in your session. And so I'll even look at my clients like, how long is the session? Sometimes my clients will be really good about fueling during long runs. But when we look at their speed sessions, I'm like, well, that's 75, 80, 90 minutes long. And that has a during run fueling implication too. And so using things like if you have a loop in your neighborhood and you can circle back to fuel, or if you're on the track, that's even easier to get fuel. Or if you're doing hill repeats, putting a bottle with calories at the bottom. One thing that we were talking about before we hit record is also starting to know in your cycle if there's any trends when your body feels a little bit more vulnerable. And so there's so many different applications now, and my clients use a variety of applications to track their cycles. And the one thing I'm learning as a provider is women, in terms of how they're feeling at different stages of cycles, are different. We are learning that towards the back half of the luteal phase, there is more protein oxidation or breakdown towards the back half. So if you have noticed that things tend to pop up in the back half of your cycle, just pay attention to that. You don't need to be scared of it, but potentially you can leverage things like maybe it's that you want to add an extra bedtime snack before you go to bed, something that is a combination of macronutrients. One of my favorite things to recommend is like yogurt and granola and fruit before bedtime, or a smoothie or something like that. Do you need more rest? Do you want to work in a down week that week, which should be normal parts of training anyway? So you're not doing less, you're just training a little bit smarter and applying pieces that are normal pieces of training, and not jumping to conclusions that I can't hit this split, I can't do this workout, whatever. You're just taking the data that your body has given you through, I think this athlete's 40 years. So she's had a lot of menstrual cycles throughout her life and a lot of data to go off of, and starting to see trends in your own cycle.
I love that you brought that up, Kelsey. One of the things, there's two things actually. One thing that I always say when I talk about female athletes and their cycle is that women have broken world records and they have won medals when they're in every stage of their cycle. So it's not that we can't do it and we should be afraid of any part of our cycle. It's that we should really understand how our body specifically interacts with each part of our cycle so that we can plan accordingly. And that's the biggest thing. And from like a PT standpoint, I often find that my athletes will come in and say, every time I'm about to get my period, I'm injured the week before. And that's a common thing that happens with women. And what I always say is like, okay, well, if you notice that about yourself, then maybe that's the week that you do more stability exercise. So if you get back pain, maybe you focus on your breathing and your core and making sure you're doing more bilateral things. So there are ways that we can manage our symptoms when it comes to our cycle, but it's so different for everybody. There's not a blanket way to do it, but if we track it and we understand it, how it's happening in our body, then we can perform better and have a better chance of not getting injured.
And like Kelsey mentioned, in terms of like not being afraid of it, I do think there's value too in just being able to know what to attribute something to, like your back hurts and being like nervous that there's something going on. Like, oh, back always hurts at this particular time of the cycle, so that's all right. We can keep moving, So I think even just being able to validate and normalize that within your head is very valuable in those scenarios too, from a performance standpoint.
Yeah, I think that's right.
One thing I was going to mention, and I've really started emphasizing this, you should be proud, Kelsey, is I've really emphasized, especially for these tendinopathic patients, like the ones who have really thickened tendons and they've had chronic issues over time. So this is different than like the 16-year-old who just increased their running and they have a tendonitis, but someone who's been dealing with this for a long time, or the 16-year-old who's had tendonitis for a year. But really emphasizing protein intake. And I've started giving people numbers, like here's some examples of what you should be looking at. Also, here's Kelsey's number. But I can't always get everyone to see a dietitian, but even just giving them like a little bit of information, say, hey, these are some things that are valuable. Collagen may have some value to it. These are some brands that are reputable, NSF's certified. So, emphasizing the importance of that impact. Or if I have people just any of my athletes who go to therapy and don't see value in it, if I'm concerned there's a low energy availability scenario, if they're not getting nutrition, you're not going to benefit from your therapy, right? You can't build muscle if you're in a deficit. And so I think it's so important that we really emphasize that foundational piece of it. I was having a conversation with a med student yesterday as well, like that she was asking about, the kind of the comprehensive nature of things. And I was like, well, if you go to PT all day, but you don't eat anything, then we can't actually benefit from it, right? So remembering that foundational piece, I think is so important, which is why Kelsey is with us every day.
The other thing I wanted to mention is making sure we have the right diagnosis. We always talk about this, but if somebody comes in and you're treating one thing, but it's actually something completely different, that's not really that helpful. So the diagnostic piece is so important. And if you're not making progress in therapy or with your MD or with your dietitian, whatever it is, you have to come back to, am I getting treated for the right thing? And do we need to reassess this area? So with this patient in particular, she was getting treated for plantar fasciitis, but it ended up being a posterior tib tendinopathy. Were some of the things that the PT doing helpful? Absolutely, because we do a lot of the same strengthening things. But until we started to treat the right issue, she didn't really make progress. And once we started to do that, unload the tendon and then do some eccentric work, some isometric work on some blood flow restriction training, make sure she's fueling enough. All of those things that really helped her turn the corner.
And that's where I think the frequent visits are so helpful. I'd like to see patients a lot more often so I can kind of see, hey, how are things shaking out? Are the onion layers peeling away? Or we're looking more at a focal issue? Because I've definitely had times where I'm like, there's so much going on. Let's start PT. Let's see where we get once we start cooling some things off and see where this focus is the main issue.
Yeah. And I think, again, just letting everyone know, if you've had something for a long period of time, if this is a chronic injury, it's not going to go away in a visit or a month or even 2 months sometimes. So patience, I think my dad always says, patience is a virtue, which we don't have as athletes. I'm just saying we're not very patient sometimes, and that's okay because, but we have to be when it comes to injury. And so just making sure you're checking in with your providers and making sure your goals are being met. And as providers, I always have my patients make their goals with me, and then we talk about them on a regular basis so that they can see the progress in which they are making, which helps decrease some of the frustration when these things take a little bit of time. But that's why, orthotics can be really helpful so that people can continue running, or making modifications to gait so that they can continue to run is really important.
I love being able to show people they're making progress when they come back and they're like, I haven't done anything. I'm like, well, hold on a minute. Look at this note of where you were when I saw you first. I'm like, oh, okay.
Well, and it's human nature to forget too. Mm-hmm. So we forget how much pain we are in when we're no longer in it. And so being able to kind of look back and show people where they were compared to where they are today can also be really helpful. So if you're somebody that's thinking, I didn't make any progress, maybe talk to the provider that you're with and say, hey, what did I say the first day I came in? Just so that you can actually see that progress as well. Good. All right, so let's circle back, and I'm actually going to start with you, Kelsey. What would be your takeaway from today?
I think that just like collecting, if you're a female athlete, like collecting data on your own body and not jumping to conclusions about what each thing means, and just really going off of your own body and having the open mind to adjust, and the open mind that, as we age, it's okay that your 40-year-old self needs a little bit something different during a certain phase of the month than your 30-year-old self or your 20-year-old self.
Great. Sara?
So the first thing is rule out the scary stuff. So make sure there's no navicular or talar bone stress injury if there's any suspicion. But actually, you're not supposed to do this and bring up brand new things in a summary. However, I remember one of the things I love that you say about this, Kate, is you need relative rest, but you also have to load a tendon. So there's got to be a combination of the two. And that's where having a multidisciplinary team, I think, is really helpful, and having lots of touch points so that you can monitor and progress things.
Yeah, you're right. I didn't mention loading the tendon in this because every episode we talk about tendinopathies, I say it. So I was trying not to, but it's true. Like, you have to load a tendon if it's going to get better. And that's just part of it. And I do think that people tend to shy away from loading it when it's painful. And so that is something that should be considered during PT and during rehab is, hey, we have to load it to get better. So maybe that's my takeaway, even though we just brought it up. And also, just because you have arch pain or foot pain when you're stepping on the foot doesn't mean that it's plantar fasciitis. Make sure that you're treating the right thing. All right. We will see you guys soon. So that's the end of this episode. Thank you for listening. And as always, if you like this episode, feel free to pass it on to your running partners, to coaches, to friends, to other healthcare providers, whoever you want to pass it along to. And if you have any questions or you have cases that you want us to present or look into, then you can email us at runcasemiles@gmail.com. And please follow us and give us, a 5-star review and help people find us. Have a great day.